Welcome to the Louisiana HIMSS podcast. HIMSS is the Healthcare Information and Management Systems Society, a global health information organization dedicated to improving healthcare quality, education, and connecting people. I'm your host, Sydney Bennett, a healthcare account lead with Tech Systems and president-elect of Louisiana HIMSS. Each month, we will chat with industry leaders who are transforming healthcare through technology and bring you insights into the latest news and trends. You can find more of our podcasts by searching LAHIMSS, that's LAHIMSS, on Spotify, Apple Podcast, Google Podcast, or wherever else you listen to your podcasts. You can also find us at Louisiana HIMSS on YouTube. And finally, be sure to stay connected with us at louisiana.hims, that's HIMSS.org, and on social media for the latest updates on events, news, and more. You can find us by searching Louisiana HIMSS on LinkedIn and LAHIMSS on Twitter. Hello, we are here today with Dr. Jeansonne from Ochsner Health System. He is the Chief Medical Information Officer there. And today we are going to be talking a little bit about AI. So welcome, Dr. Jeansonne. How are you?
I'm great. Thanks for having me.
Good. Well, super excited to chat with you today about the biggest buzzword in the healthcare IT industry, and maybe just the IT industry as a whole today, AI. Everyone's favorite, probably most favorite and least favorite topic. So thanks for joining us today. If you don't mind, would love to just make some quick introductions for everybody out there that may not know you, may not know Ochsner.
Yeah, sure. So, Ochsner is a health system in Louisiana. We're the largest health system in Louisiana, and we're throughout the state, and we're centered in New Orleans, but we have sites all over Louisiana and also in southern Mississippi, and we have some partnerships with sites in Alabama and Texas, but mostly we're in Louisiana and Mississippi. So we have over 40 hospitals that we either own or manage or are partnered with, and over 3,000 providers that we work with. So that's kind of the background on Ochsner. And just tell you a little bit about myself. I'm a general surgeon, but I work now in IT, and I'm the Chief Medical Information Officer for Ochsner. And I've been with Ochsner since 2008. Came here as a practicing general surgeon right out of my training. And I was really always interested in technology and how technology can improve patient outcomes. In my surgical practice, I was always focused on minimally invasive surgery and robotic surgery, which was kind of all about trying to create less pain, faster recovery for patients. And when I came to Ochsner, we were not on Epic yet, and in 2011, 2012, we went live on Epic, and I got involved with that, and sort of became increasingly involved with the medical records system over the years. And then in 2019, I became an associate CMIO, and then CMIO in 2020.
Well, that is quite the journey. Thank you so much for sharing that. Yes, you've definitely been at Ochsner a very long time. So I'm sure it's, very exciting to sort of see the journey over the years of where you've been and where you're going to and where you are today. So very cool story.
Absolutely.
So Ochsner has been, definitely leveraging AI, very hot topic. Like I said, I would love to hear a little bit about, from your perspective, how Ochsner has been leveraging AI so far today.
Yeah, so we had been using earlier forms of AI for a long time, for several years, in terms of predictive models and algorithms. One of the first big projects we did was our patient deterioration model, which was around 2017, 2018, which can predict when patients are going to deteriorate or get worse or have a cardiac event in the hospital by looking at lots of different data. It looks at their data from their labs and their vitals, and kind of looks at all these data points 24/7, and is able to tell within 4 hours someone is likely to get worse or have an event. And so that was one of the first things we did at scale, and it really had amazing outcomes. We were able to prevent a lot of cardiac arrests in the hospital. And so we rolled that out to all of our different facilities. And, but more recently, when people say AI, they mean generative AI, kind of the newest generation of large language models. And so we've been using those in a number of ways as well. From a clinical standpoint, probably the biggest thing that we've done is ambient listening, which I'm sure you've heard of. But if people in the audience aren't familiar, that's or if you're in healthcare, you've heard of it. But if that's where it's listening to the encounter and generating the note for the doctor. We are also using AI to create drafts for in-basket messages, because we've had a huge increase in patient messaging since the pandemic, when people couldn't get in to see their doctors, so they started using a lot more messages, and that really hasn't gone down, and it's a good thing, because we want people to engage with us digitally and save, not come in for a face-to-face encounter if they don't have to. It's very convenient for the patient, but at the same time, it's a big volume for our doctors to respond to. So we're using AI to help create a draft of a message. It's not responding to the message on its own. It's just giving a preliminary draft that someone can then read over and edit as appropriate. And then from in the clinical space, in the medical record space, probably the third area we're looking at is AI summaries, and we're a little more early on in that module, but the goal there is to kind of be able to create a summary of the patient's chart, because patients have a huge amount of data in their charts now, and patients may have been seeing. As I mentioned, we went live in 2011, 2012, so they may have information going back all the way to then. And so if you're seeing a patient for the first time, it helps to kind of get a summary of their history. And right now, people spend a lot of time looking through the chart, and so if we can save them time that way, that's something we want to do. So those are the main areas in the medical record. The one other thing we're doing is imaging AI, where we're using AI to look at CTs, MRIs, X-rays, things like that. We're using that for stroke and pulmonary embolism right now, because those are very time-sensitive things that we want to respond to the patient quickly, and that really is notifying people if a patient has a stroke finding and bringing it to the radiologist's attention. It's not replacing the radiologist. They still read it and look at it, but it kind of helps them to prioritize relative to other images if they have a list. So those are kind of the main clinical areas where we're using it.
And I understand that you were a part of the team that helped create an IT or AI, governance and steering committee. Can you tell us just a little bit about that steering committee and how you guys went about that?
Yeah, it wasn't just me. It was mostly actually our AVP, Krista Milano, who's also an attorney, was really involved in spearheading that. But I do sit on that committee and helped with forming the policies and the processes that it uses. And this is really important because we just have such a huge explosion of AI right now. It's part of everything, everything from your email, that's kind of suggesting responses to emails, to every piece of software that we use, it seems like has an AI component. And so we really needed to find a way to get a handle on that and make sure we knew what AI was out there, because sometimes you can be using a piece of software and it'll just get an update that'll include an AI component and you may not even know about it. So we wanted to monitor all that, decide what we wanted to prioritize, making sure things were safe, and that we understood how they were using our data, and all of those things that are involved in AI governance. So that we really brought together a team for that. It was a cross-functional team of people from different departments in the system. It includes IT people, it includes physicians, it includes legal, it includes cybersecurity, and from some of the IT people that are involved, we're also had experience with data governance, which was another committee that we've had for a long time. And so we evaluate all the new cases to make sure they're safe and secure. We classify them as far as their risk level into low, moderate, or high risk. And, as I mentioned, like if something's just, giving you a suggested response to an email, that would be a low risk use case. But if it's involving patient data or clinical data or clinical decisions, helping doctors make decisions, and that would be in the moderate or high risk category. And it doesn't mean it's unsafe. It just means that it's potentially high risk, and we need to look at it and see how it's working.
So how do you guys go about those are, I'm guessing, like if an end user has a request for an AI use case and they bring that to the committee and say, hey, we're thinking about wanting to implement this, and then you guys evaluate, how do you guys monitor for people that are just out there putting stuff in Chat GPT and Copilot and whatever on their own?
Yeah, sure. So doing it on their own, sometimes there's not a lot that we can do about that because we may not know about it if they're just doing it on their own phone or something like that. So we try to do a lot of education for those situations and make sure that people understand the risks of AI and the fact that they should not be putting patient information into a third party AI. And in some cases we have really had to provide an alternative to people. So if one example was like the like AI bots in Zoom meetings or any other kind of remote meeting where people are using that to take notes, and there might be patient things discussed or other sensitive things discussed that we did not necessarily want a third party AI to be keeping track of. So making an internal solution available to people so that they won't feel like they have to go use the one on their own was an important component of that. But then when we're looking at new AI use cases that we are implementing for our own system, we want to always make sure that we understand what is it trying to accomplish, what is the problem it's trying to solve, is there really a need for it, or is it just kind of a something that people are doing because it's a buzzword, like you said. What are the KPIs that we're going to follow to ensure that it is working? How is it scaled? And really, what is the how are we going to know whether it's working or not working? And if it's not working, what are we going to do to turn it off? So all these things are things that we look at, and then we also have a process to ensure data security, to ensure monitoring for bias and all of those factors.
Yep. So you hit on some good points that I wanted to ask you about. Is there's some people out there that might say, hey, how do I calculate the ROI from AI? Because sometimes it's, time, or sometimes it's just difficult to put like a dollar figure on the ROI from AI. So I'm just curious, how do you guys go about measuring the impact and the return on your investment from some of these large AI investments y'all are making?
Yeah, that can be challenging sometimes because sometimes the ROI is not financial. It can be in terms of time saved or improving people's quality of life. And I think that's okay. I think it doesn't always have to be financial. And I also think that you don't necessarily always have to establish the ROI yourself. I kind of think a lot of these new AI technologies, I kind of think of them as being analogous to like if a new medication is coming to the market. You don't necessarily have to be the one who proves that medication works. If other people have done the trials and have proven that it's effective, then you use it. So I think there are a lot of AI use cases that have already, the ROI has already been established. I mean, we still are going to track the outcomes from it, but you don't necessarily have to reinvent the wheel, I think. And but we do, we track how much time is it saving, for embassy drafts, how long is it taking people to respond to messages for ambient? It's how long does it take people to write the notes, and how much time are they spending at home after hours? And if the AI helps someone to not get burnt out or not leave the organization or leave medicine as a whole, the ROI of that is huge, but it takes a long time to realize that ROI. You're not going to see it immediately. So I think, I'm fortunate that at our organization we've been willing to take that long-term view and make that investment for the long term, so that we've been able to really look at how this affects people's well-being and not just an immediate financial return for every component.
Sure. And so I'm curious, okay, let's talk a little bit about just governance when it comes to AI, and just how big of a part of the conversation was that when you guys were standing up this steering committee?
Yeah, in terms of the ROI.
Just governance when it comes to
Oh yeah,
AI. Yeah.
yeah. I think it's really important because this is all brand new, and uh, and also we're in healthcare where we want to be on the cutting edge. We want to offer new technologies that are going to help our doctors and our patients and our other healthcare providers. But at the same time, you have to do it in a way that's safe. Um, so I think getting all those different people together to look at this is really important, and I think it's important also for just maintaining transparency and maintaining trust, because you don't want to roll these things out too fast and then have a situation where people don't trust it and then they don't use it, and you're not really achieving anything.
Absolutely. So, any recommendations that you have and I'm sure you get asked for advice and recommendations a lot when it comes to AI, but just any recommendations for others out there that are listening that, maybe trying to spin up their governance structure for AI?
Yeah, I think a lot of people, everyone's dealing with the same issues, and I would say just when you're putting together your group, have as many different voices as you can. I mean, that's one of the great things about healthcare is we have so many different roles and different people with different backgrounds and different areas of education. So physicians are going to think of different questions and problems than attorneys will, than IT experts will, and so I think having all those different perspectives, the more perspectives you have, the better. And and it should not be hard to get people involved because a lot of people are very excited about this. So it's usually not difficult to find people who are interested in helping out. And ideally, I think it's also an opportunity to get people involved who aren't necessarily the same people that at every meeting that are involved in everything. So I think just having those different voices is important.
I'd love to go back to something that you were just talking about as far as like how much people trust the AI. So there's a lot of folks out there that have a lot of doubts about AI. They hear about AI hallucinations or ethical concerns, security concerns. Just would love to chat with you a little bit about some of the safeguards that you guys have put in place to account for some of those items.
Yeah, no, I think it's okay to be doubtful. I think it's good because I think, as I mentioned, we do have to be cautious, and you can't just turn these things on without making sure it's safe. And I think going back to the analogy of medications, the way we handle this medications are very similar. I think situation because it's a situation where you want to get the benefit, but you also don't want to put people at risk. So the way we handle it there is first we test it on not on humans. We test it in the lab or in mice or in some other model. And so the analogous situation to that would be testing in our non-production environment or our test environment where it's not a real medical record. It's using either fake data or it could be real patient data, but it's not actually being used in the live environment with patients. And so then you can test it to see how accurate it is before you ever actually use it in real life. And then the next step, is to do trials. So we will do uh, small pilots with a small group of doctors who understand that this is something we're testing. And the ultimate goal of the AI is to save people time. But I think in these small pilots, we have to make it clear to people that in this phase, it's not going to save you time. We want you to be looking at it very carefully and giving us frequent feedback so that we can make modifications to it. Because you can tweak like the prompts for these LLMs to make them work better and to help them learn. And so that's kind of you do that small pilot to establish safety, and then once you've done that and you see that it's working well, then you kind of gradually scale it out from there, getting feedback. So that's kind of how we've approached it. And you mentioned hallucinations. I think that is an issue with all of these AI models, not just in healthcare. Um, but we've put a lot of focus on education and making people understand that they really do need to verify any info that comes from the AI. And I mentioned that, we're not having the AI respond to patient messages automatically. It's purely just generating like a first draft. And, we've told people if the AI suggests something that you would not normally have said on your own, don't use that. It's not supposed to be generating ideas. It's supposed to just be saving you time typing, basically. And I think the easier use case though is like for notes and messages. If you're using it to transcribe notes from a visit that you were present for, or you're using it to generate a draft, you can read that and you can correct any errors or anything that you don't agree with. But it becomes a bigger issue with summaries, because if you're using it to summarize the chart, you don't know everything that's in the chart. That's why you're looking at a summary. And so we really are having to train people to verify any info that you're using to make a clinical decision, because the hallucination rate is very low. It doesn't happen often, but it does happen. And this is really no different, I think, from the way we've always done things. If somebody, if you're a surgeon and someone tells you that a patient has, a hernia or something, you're not just going to take their word for it before you do surgery. You're going to verify it that it's real. And so, in a similar way, if you're making a clinical decision, we want people to always verify, and we make it easy because with the summaries, you have links back to the primary source in the chart where it got that information from, so you can very easily verify. So that's how we've handled that. And then I think for the ethical concerns, we just try to be as transparent as possible, and always let the patients know when we're using AI. We're not trying to do it in secret or trick anyone. When we use a draft, we have a message at the bottom that says this was auto-generated and reviewed and edited by the author. And so we are letting our patients know that we're using this so that they understand and they become comfortable with it as well. And then just also making sure that it's secure. We always make sure that if we're using a third party for AI, we want to make sure that they are up to our security standards. So that's something that's part of that governance process.
Awesome. Thank you for those details there. I want to just hit on one more kind of related topic there with that, but a lot of there's been some reports in certain AI models around bias from like a health equity perspective. Do you guys take that into consideration at all? And if so, how?
Yeah, absolutely. I mean, I think that's always been an issue with any kind of AI, because it's going to, our own human biases are going to be reflected in the AI, since it's using human data. And that's part of our AI evaluation process. And if we're using if we're developing ourselves, we can monitor that on our own. If we're using a third party vendor, we require that they describe to us what their own bias monitoring system is. And I think it's it's still early. It's still something we're figuring out how to do that exactly. But I think it's something you have to be constantly vigilant on, because these models change over time. And so it's not, I think in the past, when we would approve new software, we would look at it and make sure it was secure, make sure the data wasn't going anywhere we didn't want it to go, and then that was it. But with the AI, it has to be a continuous thing every year, or every some period of time. You have to keep looking at it to make sure that it's not changing.
How important are data sources, do you feel like, when it comes to AI?
Yeah, that's really important, because obviously if you don't have good inputs into the AI, you're not going to have good outputs. So we've spent a lot of time before we were even using AI. We spent many years trying to make sure we had clean data in our system. That's something that's been a high priority for us. And we try to use discrete data whenever possible. If we can have data elements as opposed to just free text, we prefer that. And anytime we've had a lot of growth over the last few years, and we've had a lot of systems that we've partnered with or we've merged with. or that use our system and might be transferring from an old system. So anytime we import data from from another system, we always put a lot of effort into making sure that it's well validated. And so I think from the user standpoint, if the AI, whether it's generating a bad output because of bad data or because the AI itself is broken or because it's hallucinating, to the user, it's all the same thing. So, we've had situations where people thought, oh, well, this model isn't working. And well, if it doesn't have the right data that it needs to generate its output, then it's working. It's just not getting what it needs. So that's something we put a lot of effort into.
Yep. Very important. First impressions, make a big impact for sure. So I'm sure this is a very hard question to answer because, but I want to ask you about the future of AI in healthcare. I know that's sort of hard to think about because, would we have predicted that we would be here, even 2-3 years ago? But just curious, like, what are the future use cases that you guys are looking at for AI at Ochsner, and just where do you see AI going in healthcare in general?
Yeah, you're right. That is always a tough question because whatever I say, it's going to be wrong. But I can tell you, I can tell you where I would like it to go. I think if you imagine kind of all the steps that people go through in order to take care of their health, both from the standpoint of the patient and also from the caregivers, I would like to see AI assistance in every step of that process. So, it should be helping people to stay healthy so they don't have to go to the doctor. It should be helping them. If they do need to go to the doctor, it should help them find the right doctor and help them get an appointment and help them find where they're trying to go if they don't know where they're going. It should help the doctor document the visit and order treatment for them. It should make it easier to get reimbursement from insurance companies for the costs. And then if the patient has, afterwards the patient has questions, it should also help them get their questions answered faster. So I think how the specifics of how that's going to happen, I think we don't really know, but I think people are always going to want things to be easier and more efficient. So I think that's where I would like it to go.
Yeah. Well, thank you so much for your time today. Very insightful. I know a lot of people in the region and just nationally lean on Ochsner and kind of what you guys are doing in general from a technology standpoint. So, I'm sure this will be very beneficial for others to hear and perhaps try to implement some of these measures themselves. So really appreciate you taking some time to chat with us today.
Yeah, I appreciate it. It's very exciting. I think there's going to be a lot of changes, a lot of good changes in the next few years. So I appreciate the opportunity to talk about it.
Absolutely. Welcome to the Louisiana HIMSS podcast. HIMSS is the Healthcare Information and Management Systems Society, a global health information organization dedicated to improving healthcare quality, education, and connecting people. I'm your host, Sydney Bennett, a healthcare account lead with Tech Systems and president-elect of Louisiana HIMSS. Each month, we will chat with industry leaders who are transforming healthcare through technology and bring you insights into the latest news and trends. You can find more of our podcasts by searching LAHIMSS, that's LAHIMSS, on Spotify, Apple Podcast, Google Podcast, or wherever else you listen to your podcasts. You can also find us at Louisiana HIMSS on YouTube. And finally, be sure to stay connected with us at louisiana.hims, that's HIMSS.org, and on social media for the latest updates on events, news, and more. You can find us by searching Louisiana HIMSS on LinkedIn and LA HIMSS on Twitter.